And today we're going to be talking about kids' mental health. Kids, they are, by virtue of being kids, powerless. And so while we as adults had some coping skills in order to deal with the grief and the change of the last year and a half, they don't. They haven't had the skills. So, yes, they're super resilient. There's like this argument between like, are kids resilient and are they going to bounce back or are they suffering? It's both. They don't have the coping skills and they don't have that frontal lobe developed. They've really been lacking a lot of power, a lot of skills in order to kind of navigate the last year and a half. It's in childhood that most emotional disorders set in. A lot of parents may not identify the signs of mental health. Parents might not know, but so much of anxiety and depression has its basis in childhood. Most of the adults that we work with in private practice, they date their anxiety and depression back to childhood. I would love for the parents listening to really take that advice about using this summer. It's great to unwind during the summer, but really using this summer to somehow do something very purposeful to recharge from what we just came off of and take this inventory of how are we really doing and what can I do for my family, for my kids to support them on this emotional journey, and what might I not be able to do and I need to maybe reach out for help. Parents often really struggle with seeing their kids in pain. It is hard to see your child struggling. It's hard to see them crying. Because it's hard to see our children in pain, it's often our own discomfort that shuts down that communication. Many parents tell me, well, my kid doesn't share anything with me, or they tell me everything is fine. And one of the things I ask parents to pay attention to is your child not wanting to burden you? How are you with taking in big emotions and big experiences? Not to mention that there are many times where parents will say things like, don't cry, or, let's go out and buy you this thing that you really wanted and make you feel better. How can I cheer you up? And it's from such a great place, but ultimately that shuts down the disclosure. Kids who are managing anxiety and depression and some of those other disorders, they might be putting forth a significant amount of effort to hide that. And they might have really bubbly personalities. People around them have no clue, and they might be just a pleasure to have around when they go to other households, and they're popular and they're got a ton of friends around them, but on the inside they're struggling. This is where those conversations are really important. We pay attention to feelings, we pay attention to our experience. We don't shove it aside. We don't just go, go, go. We pay attention to experiences. I want to share a kind of what I'm seeing a lot of. I think because of the things we've been through in the last 15 months, a lot more eating disorders than I've ever seen before. I think it has to do with the lack of control that everybody felt over the last 15 months and to some degree still feeling. I think the increase in eating disorders really goes along with that. And I think parents are really not paying attention to this. I'm also seeing, well, I mean, I think it goes without saying, a lot of grief and anxiety and depression lately coming off of this last 15 months. I'm seeing a lot of vaping and drug use with teens. And again, something that is not going very noticed by parents. So teens are really quite skilled at hiding, getting drugs delivered to their parents' households in the middle of the night without the parents knowing. I think parents really need to be aware of some of these things that are in the backdrop and, some things that maybe are going unnoticed by many other parents, and maybe we can specifically keep an eye out for those things. I'm also seeing many more kids get to the end of their rope and just express that they're not wanting to live anymore. Lots more suicidality than I've ever seen before, and it's really concerning. Parents struggle with that because I see one or the other extreme happening. Parents freaking out, calling me, crying, should we hospitalize the child, or um, downplaying it and saying, I don't think he means it. I don't think she means it. And this is what I say to parents about suicidal statements. If your child has stated something that intense, if your child has shared with you something that intense or with somebody else, even if they don't intend on actually going through with suicide, even if they don't intend on attempting suicide, they're telling you they're at the end of their rope. Parents need to pay attention to that.